A medicine commonly used for weight loss looks like it may have another use, helping the heart.
That's right. The drug is Zepbound, and new research found that it actually lowered risks of worsening heart failure and cardiovascular death in obese adults. Our night health expert, Dr. Paul Coley, is joining us now with more on what this study found. Dr. Coley, good morning.
Hi, guys. Good morning.
Okay, so the study looked at a special type of heart failure that is much more common in patients who are obese. Can you tell us a bit more specific about this type of heart failure?
Yeah, so think about what the heart does. It does two things, right? It squeezes and then it relaxes. So there's two types of heart failure, about half and half. One is a problem with squeezing, where the heart is weak. That's called HFrEF. And then one is a problem with relaxing, where the heart gets stiff, like a lead box. And that's called HFpEF. And the HFpEF, that second type, really common in patients with obesity, with diabetes, with sleep apnea, with high blood pressure. And it's been the one that's been harder to treat. So up until now, we really haven't had a lot of medicines. We just kind of give water pills or diuretics to help take fluid off, to help people feel better, but we don't have a way to reverse the pathology of the disease.
So what did the study find with this one?
Oh, it was standing room only at the American Heart Association, and everybody was tweeting about this study because it was a home run. And so essentially what it found is that people who got this medicine that are obese versus placebo, A, felt better, so their quality of life scores were higher. B, they did better, so their 6-minute walk test, which is a way to sort of assess heart failure, was better. They lost about 11.6% of their body weight. Their inflammation markers went down.
Wow.
And take it even further, they had less risk of developing a heart failure hospitalization or cardiovascular death. So now you're talking about hitting on so many different axes, making people feel better, but also helping their heart.
That is huge. And of course, I think one of the reasons it was standing room only at that conference you were talking about, this study seems so impactful. Why is that?
It's really, really impactful because it's one of the few drugs where we're not just treating ourselves, meaning, oh, the patient lives longer and the patient has less disease, but we're actually treating the patient. So think about it, the patient feels better, they lose weight so they look better, and you're treating the underlying pathophysiology. And one of the interesting things about this drug has really been the journey of the drug.
Yeah.
You know, as you've seen over the last decade, it started as a diabetes drug, this whole class of medications. Then while it was being studied for diabetes, we realized it was hitting for other things like weight loss. While we were studying it for weight loss, we realized it's hitting for heart disease, so it became a heart attack drug. Then while it was hitting for heart attacks, most recently a kidney disease drug, and now heart failure drug. So you're talking about treating obesity, actually treating so many organs. And in the past, when we used obesity medicines, they got a bad rap because they would whip the organs, right? You would stimulate your metabolism, it would hurt the heart, but this is the exact opposite. By treating obesity, you're actually protecting the organs and protecting the heart.
Would you like to see the stigma taken away from some of these weight loss drugs, considering they do so much?
So much so. I mean, I'm desperate to have that stigma taken away. And that's why these types of studies I'm so excited about, because I want anyone out there who's obese, has a little extra weight, may have heart failure, may even have had heart attacks, to talk to their doctor about these drugs, because we need to stop classifying them as vanity drugs. They're not vanity drugs. They're not shortcut drugs. They're life-saving drugs. They're reducing cardiovascular death. And so we really need to start sort of reclassifying them as heart disease prevention drugs or kidney disease prevention drugs, cardiometabolic drugs. And I want people to really feel empowered and not be shy. I have plenty of patients who I have on these drugs who are actually embarrassed to tell their friends that they might be taking a drug, but they don't have that same kind of stigma with a high blood pressure drug,
right,
or, you know, a different cholesterol drug or what have you. So I think that the history of the drug has stigmatized it, but I really want people to feel empowered by this data that you're preventing heart disease, heart failure, heart attacks, protecting your kidneys by being on these types of medications.
If you are doing something to better your health, good for you, and that should be praised, not shamed. All right, Dr. Coley, thank you very much. By the way, you can find all of Dr. Coley's appearances at 9news.com/Dr. Coley.